Thank you for joining us. My name is Shapir Rosenberg, and I'm the editor-in-chief of the Residence Journal. And my guest tonight is Rachel Dillinger, who is a second-year psychiatry resident at the University of Maryland program in Baltimore. Hi, Rachel.
Hi, Shapir. Thanks for having me.
You're most welcome. Thank you for agreeing to talk with us. How are you doing there, Rachel? And how are you doing currently in terms of all that's happening because of the pandemic?
Well, I've been really impressed by how my co-residents have responded to everything. So it makes it easier to get through everything when you have people like that around. Hanging in there, we're still far from the worst of it here in Baltimore, but really interested to see how everything turns out and just hoping for the best.
You allude to how it is that your co-residents are handling things that helps you. How is that? How are they handling things that's helpful?
So, as this is a situation that a lot of people haven't had to deal with before, both, from a resident standpoint and an administration standpoint, there are a lot of opportunities in which people can step up and advocate for themselves, for their patients, for their co-residents, for other staff in the hospital that they didn't have the opportunity to do before. No one really knows quite how to navigate this perfectly. Seek guidance, obviously, from the CDC, the World Health Organization, other bodies like that. But there is, some ambiguity. So it really opens up an opportunity for people to step up and advocate and make decisions about what they think is best. So, one of my co-residents, there wasn't a protocol in place. So really advocated, figured out what are the current guidelines and tried to make sure that we weren't acting as vectors as residents, going from one unit to another in a pretty substantially sized hospital and unknowingly transmitting things. And I feel like the fact that people did jump on this as early as possible probably prevented some more transmission and better spread of information.
Well, that's good to hear. I know we could talk a lot about the current events, but I wanted to interview you for the podcast for two main reasons. One was to hear from you and then have you share with listeners some of what your experience has been like working on the Residence Journal editorial board this year, and then, relatedly or not, to discuss some of your views and experiences and feelings about being a trainee with a family of your own. And so maybe we'll start with the first part of that. And that is, I know this year was the first year that you came on board the Residence Journal. I suppose I'll first ask, why did you even apply last year for the position? What motivated that?
So what motivated me to apply for a position in the journal in the first place was the fact that, looking over some of my colleagues and peers' work has been something that I found really enjoyable throughout my life. I've always loved reading things. I've always loved writing. And I thought that it'd be a good opportunity to get some more formalized training and be able to incorporate something I really enjoyed doing more into my everyday life. So that's why I applied in the first place.
I see. And then you were invited to be an associate editor. How has the experience been so far? We're now 9 months through the year with 3 months to go.
Yeah, it's surprising how quickly it's passing. I know when I first started out, I was somewhat confident in my ability to read a paper and, identify things that I've been trained over the years to look for in more of a copy editing type of way. But as the year progressed, getting different mentoring and advice from you and other members of the journal, I found that my focus really shifted from the trees to the forest. So whereas before I was focused on, grammar and parallel structure, now I'm focused a lot more on the larger picture of the piece, how things are formatted all together. Is it even appropriate for the journal or not? So I feel like I've learned how to do a much more comprehensive and intensive job. And I've already seen it improve my own writing. And then my ability to help some of my friends throughout the year has definitely gotten better.
Well, I'm delighted to hear that. I've certainly observed how your work has your work as an editor and as a reader has grown and improved over the course of the year.
Thank you.
Were there certain kinds of papers that you liked reading before, meaning in college or in medical school? And has that changed or evolved in any way since you've been in residency?
So back earlier on in high school and college, I definitely enjoyed things on the somewhat shorter side, like maybe a page or two long, more in the psychology, arts, and humanities domain. But knowing that at that point, my medical knowledge, my knowledge of psychiatry was definitely not the same. Now that I'm in residency and that aspect has improved, I found that I'm drawn more to the lengthier papers and the papers that are primary research and reviews and a bit more complex. And I've really enjoyed the fact that through working with the journal, I've been able to get a better grasp on those pieces. And I think that's made them a lot more enjoyable to read. And that's extended beyond just my role as an editor, but even when I'm reading, articles on my own to improve my own knowledge, which I think has been super helpful.
What kinds of articles do you read on your own?
So I really like, obviously, the subscriptions that are sent to most psychiatric trainees across America. So through involvement in the APA, I get the American Journal of Psychiatry, and I promise that's not a plug. And then also Current Psychiatry is sent here, but then also, as different patients come up, different situations that I find really interesting. So lately, I've been very into stigma related articles, especially in adolescence, because I think it's a really important age group to target. So I've been reading a ton around that, and then also starting to get into more of the perinatal mental health, just out of, my own experiences as a mom, and thinking that maybe that would fit into my interest in a professional light as well. So just trying to let my interests guide me in what I've been consuming, but feeling more able to consume it than I did before.
We will certainly come to your experiences as a mom in the second half of this interview. Could you give our readers and our listeners an example of what you mean when you talk about stigma in adolescence, and what kinds of things you're reading about that now?
So they've done a lot of research trying to figure out what is the stigma of mental illness, when does it develop, what goes into it. So chiefly what we see is that individuals with serious mental illness are perceived with the thought that they're dangerous, that they're unpredictable, that they should be avoided. I know social distancing has gotten a lot of press lately due to the pandemic, but in mental illness stigma, it means that people feel that they need to both keep themselves distant from people with mental illness, and also that people with mental illness should be kept away from society at large. So something that interested me is, where did this mental illness stigma come from? How early does it present? And it turns out that even in children as young as 6, they already have those biases present. So it's been postulated that this mainly comes from internalizing caregiver views from their parents and other loved ones, but then also from the media portrayal of mental illness. And I could go on about that for a really long time, but anyone who's watched the news within the past few years knows the type of rap that mental illness gets and its connection with perceived dangerousness in people with mental illness. And it's something that I feel very passionate about addressing.
Thank you for elaborating. And to bring it back to how a topic like that might relate to the academic literature and the residence journal, like what kinds of articles do you read about that? Are they commentaries? Are they studies of certain kinds? For instance, qualitative studies? Or how does one who would be interested in a topic like that, what kinds of articles would one find?
So where I started was with meta-analyses and systematic reviews. And when things would jump out at me from the things that they would state, I would go back to the sources that they cited. And that was a collection of both quantitative and qualitative things. So there are a lot of interventions out there where people will try and use various approaches to try and address stigma change, especially in this population of adolescents. So I would read those articles and the data they would collect through surveys, open-ended responses, conversations with the caregivers would be really powerful, would really help me to understand it better. And then also there are commentaries as well from people who are well-versed in this topic that I found beneficial to read.
Well, that all makes sense. And, when you mention meta-analyses or anything in the more quantitative realm, it's something that the Residence Journal admittedly doesn't publish a whole lot of. It's something we'd certainly be open to, but we don't see a lot of that. I think in part residents don't have a whole lot of time to formulate ideas and then design studies and even meta-analyses and the statistical work that's involved. A lot of folks just don't have time to do while they're in training. And so certainly in my tenure as this year as the chief editor, and even last year, I saw that the vast majority of what the Residence Journal publishes and even receives in terms of manuscripts are more in the commentary realm, in addition to our other article types.
And I would certainly love to read more of the primary data as well. I know I've read a couple of those within the past several months that I've enjoyed. But it does take, as you said, time, some knowledge, and also having the infrastructure there to support, especially when it comes to statistics. I know that I've had to rely heavily upon my institution when it comes to things like that. Even having the statistical software isn't something we always have access to as trainees.
Rachel, you're having mentioned statistics affords me an opportunity to segue to asking you if there were any surprises in your tenure to date on the editorial board. I remember a manuscript that I was reviewing, I think it was last year, that did have some statistics, and I felt it was kind of out of my league, and struggled to review it, and was seeking other reviewers who might be able to help with the piece and who had some expertise that I didn't have. So were there any kinds of surprises that you encountered so far in your work for the board?
So a surprise that I wasn't anticipating was when I received several poems to review for the journal. Poetry had been something that I'd written since I was young and enjoyed, but kept to myself. So I didn't publicize the fact that it was something I was interested in. So when it was sent to me, I was definitely taken a bit aback, but being able to go in and research what to look for in a poem, connect that with what I had already known from my own experience, and then be able to identify areas where it could be improved or made stronger was definitely an area of growth for me, something I didn't expect to happen, and even renewed a little bit of interest in writing poetry for self-reflection, even during the current times that we're facing. So that was certainly a surprise.
Do you think poems have a place in an academic journal of psychiatry or an academic journal of medicine?
I definitely do. I know that psychiatry sometimes has a negative bias towards it by different medical specialties, but we really are medicine plus art. And I feel like without including different things like poetry, photography, other forms of art, that you're missing some of what psychiatry encompasses. And there are some things that can't be expressed in an article or in a commentary that I think is captured beautifully in poems that we've had submitted to us.
And every year we do get a few poems, and it's always a challenge, I think, both to find reviewers who would feel comfortable to review them, as well as who might do a good job at it. But it's something that I've certainly encouraged and even tried to nurture some reviewers through the the process of critiquing a poem. By no means an expert myself. Rachel, your comment about the way in which psychiatry is also an art makes me recall a line that I've sometimes quoted in presentations, and now I forget where I read it so that I could attribute it, but they liken patients to poems and say that a patient is like a poem. You don't quite know what it means or understand what it means all at once up front, but it slowly reveals itself over time. And I always like that.
That's pretty spot on.
Rachel, why did you apply for the Residence Journal Board again this coming year?
So I feel incredibly grateful that I've had this past year to grow in several different ways through my participation. And I felt that by continuing on in a different role next year, that I would be able to help people in the same way that I was helped, help them figure out how they can become better at reviewing, strengthening pieces, because it really is a ripple-like effect in that not only does it help people who work within the journal, but also helps authors develop further. Because for many people that I've spoken with and seen, it's either the first or one of the first articles that they've ever submitted. And this might be their initial contact with, the world of journals and submitting articles in academic medicine. So it really is a pivotal place that we can meet them where they are, help them to improve their piece, regardless of whether it would end up being something worthy of publication. But we're in a unique position where we can help people and build them up so that it can help them in their future. And I think that's a really special thing about the Residence Journal, and I wanted to keep being a part of it.
And I'm delighted that you did decide to apply, and I know already that you were appointed, and it's been announced that you were appointed deputy editor, one of the 3 deputy editors for the coming academic year, and I think you will serve the board very well in that position. I really liked your explanation of how, I think the phrase you used was, it's a sort of pivotal moment or a pivotal time to positively impact a writer, a physician writer, in the course of their early career. And I would even take it a step further and say it's a very vulnerable space when a writer submits a piece of any kind, especially though personal reflection type pieces or poems, but really any kind of manuscript to us, waiting for our feedback about it. And aside from the fact that I enjoy writing, that I enjoy reading the work of others and thinking about how things could be said better or arguments phrased differently or the like, or whole pieces structured differently, I like being a person in those vulnerable moments and in those delicate moments to teach and to positively impact a person, in this case, in terms of their writing, but not only in terms of their writing. Sometimes through their writing, we as reviewers and as editors giving feedback can inform how they perhaps look at patients or view themselves as doctors or approach clinical care based on how on the feedback we give them, and even not only the sort of what we say, but how we say it. In that way, we can model for them, ideally, the best of humanistic medical practice and humanistic doctoring and humanistic teaching. So I like that you appreciate that part of an editor's role. Well, Rachel, before we shift gears, is there anything more that you'd like to say about your time on the Residence Journal board? thus far?
I think I've shared pretty much everything I had in mind, but I would definitely encourage anybody listening who's wondering if they should or shouldn't submit, definitely to go ahead and do it, because we really are here to help. And I think everybody has something valuable that they could contribute.
I would echo your comments, Rachel, that any trainee should seriously give consideration to submitting a manuscript, even if they aren't sure about its publishable quality or not. I would say that the Residence Journal is a truly unique opportunity to submit a piece as a trainee to a group of other trainees who will peer review and offer generally very positive and supportive feedback of any kind of manuscript. Unlike most, I don't know the exact statistics, but I would say unlike a lot, maybe a vast majority of major medical or psychiatric journals that reject most of the pieces that are sent to them, the Residence Journal rarely rejects pieces straight away. We almost always give authors a chance to revise a piece once, if not twice, and if it becomes clear that a piece will simply not make it to accepted status, then we notify the authors of that. But we always do try in a very supportive way to help guide an author through a revision process. And sometimes it does take a number of revisions till a piece becomes of publishable quality, but I think a lot is learned in that process. The way we do it and the supportive way we do it is the hallmark of the Residence Journal.
And I personally find those cases to be the most fulfilling and rewarding to work with, because there is the greatest opportunity for growth, both for the author and for us as reviewers. And as you mentioned, at different academic journals, sometimes the most you would get with a rejection is just that the piece was not suitable, but wouldn't go into specifics, wouldn't offer recommendations for improvement anyway. I feel like that's one place that the Residence Journal really does take the fact that it's a trainee journal very seriously, and has benefited a lot of people who've submitted in the past.
I agree. So, Rachel, switching gears, let's talk about being a resident or a medical student. I'll be interested to hear, because I don't myself know more about your personal biography, but what about being a trainee and a parent? So I guess will you tell us first, whatever you'd be willing to share to our listeners, really the world over, about yourself and who comprises your family right now?
Of course. So, my family right now is myself, my boyfriend Sean, and our daughter Stella, who's about to be 2. Found out that I was pregnant shortly after submitting the residency application. So, throughout interview season, I was increasingly more pregnant and obviously apprehensive about how that might affect my chances and how that would affect any professional dreams that I had, or all that sort of thing. I remember one of the interviews I went on, I was 7 or 8 months pregnant, very obvious. And of course, people aren't allowed to ask about that sort of thing. But they did mention about different childcare on site, other things that they had to offer, and mentioned that they found that if a resident was going to be successful, they would be successful whether or not they had children or a family or other obligations in their lives. So I've found that there's definitely the need to advocate for yourself when you're a parent in residency, because there are things that you have to get done, whether that's, finding time to pump if you're deciding to, provide breast milk for your child, making daycare pickup times, being there for your family despite pretty grueling hours. But it also adds such a richness to your life. And I've found that I feel I'm better able to relate to the majority of patients that I see. Obviously, anybody with a toddler knows that they test your patience. And that's certainly translated well into my work. I find that I'm more focused and efficient when I am at work because I know when I come home, I just want to be there 100% with my family. And it's really added to my life and not subtracted from my work like I'd been worried about, a couple years ago. So I'm just really thrilled with the experience, and it's definitely added a lot of different hurdles, but overall, it's just allowed me to re-experience so many things in life and to see them as wonderful and novel and exciting through my daughter's eyes, which also helps when, you have a particularly grueling day at work or you're carrying some of that emotional baggage home. But then when you get home and you're with your family, for me at least, I know this might not be the experience for everybody, but that tends to melt away.
Thank you for sharing that, Rachel. It's interesting you talk a bit about how being a parent to a toddler impacts how you are as a clinician vis-a-vis your patients. For instance, perhaps having acquired more patience with the C, that is, for having spent time with a toddler. I'm curious to ask the question in the opposite direction. Has your work as a psychiatry resident or your study as a psychiatric trainee, be it through books or journal articles or in didactic sessions of any kind, impacted or informed how you are as a mother to your daughter or how you are as a partner to your boyfriend?
I definitely feel that it has. Some ways more practically, like I had a great rotation on a child neurodevelopmental unit. So learning the different behavioral techniques and developmental stages has given me a lot better insight how to handle different tantrums, different experiences that my daughter goes through. But then also, learning through conflict de-escalation and that our patients come to us in very difficult times. Although I think everybody could benefit from seeing a psychiatrist, it seems that for the most part, people come to us when they're at some pretty low and dark places in their lives. And with that carries some intense emotions. And when you're a year and a half, 2 years old, you don't have the best language abilities, the best way to express yourself or advocate for yourself. So I found that having created somewhat of a holding space for my patients in that sense to hold those intense emotions and whatever they could bring at us has made me a lot better able to create that same sort of holding environment for my daughter. Because I'd imagine it'd be pretty easy to get upset at somebody who's screaming because they said they wanted milk and then you give them milk and they throw the bottle and say they don't want it. But, they're dealing with some intense things, and I know that I just need to employ some patience, give her space, and that things will get better. Maybe it's a bit biased, but I think it does make us better partners and better parents. It's just how I feel about it.
Well, thank you for those reflections, Rachel. Being at the tail end of your second year of residency now, have you given thought to what you would like to do when you finish residency?
I feel definitely something within the realm of academic psychiatry. I really enjoy mentoring and teaching and can picture education, definitely being a component of my career, which is obviously easier to do at an academic center. But I also have a passion for educating the community. So finding a way to incorporate that as well in a job that would allow me the latitude to not just help mental health on the scale of the patients that I directly see, but also trying to affect change in the community in which I live and on a greater scale. And I think academic psychiatry is probably the best place for that. But as you mentioned, coming up on the end of second year, so I still have half of residency to go, the entire outpatient year. So I'm excited to see how my views and opinions change over that period of time, and see how I would answer that question in a year or 2 years from now.
Yeah, that makes sense. And having reflected on the experience of being pregnant and during medical school and caring for an infant and a toddler um, uh, in residency, any thoughts about how you would like to blend your roles as psychiatrist and mother and partner in the future when you graduate?
I think mentoring, there's definitely a role for it in that, because obviously, around 50% of psychiatric trainees are female, many of which will face similar things to what I do. And finding some way to incorporate that into my job, whether that's through, medical school education or residency education, being a supervisor, offering mentor services in some other way. I'm anxious to be able to give back, but I also think it's very important to make sure that your cup is full before you pour from it. So I want to make sure that everything is great from a personal perspective, and that my family's needs are taken care of in whatever job I end up at. And then from there, being able to give more of myself.
Well, and Rachel, in my experience working with you and in your time on the Residence Journal, I anticipate that you would be a wonderful mentor.
Thank you so much. I really appreciate it.
Any final thoughts or reflections or feelings that you'd want to share with our listeners pertaining to the Residence Journal, your experience on the board this year, what you might look forward to next year, parenting while in residency? Any final thoughts?
Just that it's so incredibly important to be your own advocate and to take chances, and to know that when you put things out there, you can find a way to make it work and learn from it, whether that's submitting one of your wonderful pieces to our journal or deciding to go ahead and start a family in either medical school or residency, which isn't always seen as the easiest task to do. Just going ahead and being your own advocate, knowing that things are going to work out, and even translating that to what we're currently facing. There's so much uncertainty right now with the pandemic going on, but knowing that people have what it takes to cope with this and rise to be the versions of themselves they need to handle what's been going on.
Well, Rachel, thank you so much for talking with me tonight. I hope our listeners enjoyed hearing a bit about your experience on the Residence Journal board. Perhaps they will be encouraged to submit their manuscripts or even podcast ideas to us. I also enjoyed hearing about, and imagine they did as well, some of the challenges and joys of being a parent and a partner while in residency. So thank you.